heart failure, there's a lot your healthcare team can do to help you. There are also things that you can do at home to keep yourself well. One of the most effective ways to stay well is to pay attention to your body and your symptoms daily and know when to get medical help. Many symptoms of heart failure are really subtle and can be easy to overlook or mistake as being tired from extra work, getting older, feeling hot on a really warm day, or feeling out of shape. For people who don't have a heart condition, occasionally experiencing these kinds of symptoms isn't usually a big concern. But when you have a heart failure diagnosis, small changes in how you feel from one day to the next are very important to recognize. Often, heart failure symptoms start small and can get worse quickly. Knowing what to pay attention to allows you to get help early, avoid serious issues, and take control of your health. The heart failure zones are a tool you can use to guide yourself and your loved ones on when to get help. When we look at the heart failure zones, imagine a stoplight with 3 lights: green, yellow, and red. Each light is a zone. Some people like to put the heart failure zones handout on their fridge or by their scale as a reminder. Try making daily check-ins part of your routine. For example, to check for extra fluid buildup, weigh yourself every morning, before breakfast, and after emptying your bladder. Compare your weight to the day before. Also, do a quick check-in of your symptoms and how you feel. Check for any swelling in your feet, ankles, or stomach. People living with heart failure tend to move between different zones, depending on how their health is doing and what's going on in their lives. There are many reasons you might move from one zone to another. Some of these triggers are in your control and others aren't. Sometimes you can do everything right and your heart failure still gets worse. The most common triggers for worsening symptoms are illnesses like a change in your heart rhythm, kidney problems, a viral illness, or worsening of another health condition. Dietary changes like eating more salt than usual or drinking alcohol. Anything that makes it harder for you to follow your usual self-care routines, like times of high stress or traveling away from home. When you're in the green zone, you're doing well. The goal is to be in the green zone most of the time. In the green zone, your symptoms are under control. You don't have new or worse shortness of breath, chest pressure, or discomfort. There is no new or extra swelling in your feet, ankles, or stomach. You don't have any new or unexpected weight gain. To keep yourself in the green zone, it's important to make healthy daily routines that can work for you. This can include managing stress, staying active, taking your medications on time, and eating a healthy, low-salt diet. It's also helpful to try to maintain a balance between activity and rest periods. That means trying to spread out activities in your schedule and take breaks between tasks when you can, instead of doing a lot all at once. When you're in the yellow zone, that's a warning. Your symptoms are starting to get worse. Call your healthcare provider if you are experiencing any of the following symptoms. Your weight has gone up by over 4 pounds, about 2 kilograms over 2 days, or 5 pounds, about 2.5 kilograms in a week. You've been vomiting or had diarrhea for over 2 days. You feel more short of breath than usual. There's swelling in your feet, ankles, legs, or stomach. You have a dry, hacking cough. You feel more tired than usual and don't have the energy to do daily activities. You feel lightheaded or dizzy. You feel like something is just not right. It's harder to breathe when you're lying down, or you sleep better with extra pillows or sitting up in a chair. As soon as you realize you're in the yellow zone, it is important to call your healthcare provider right away. They may be able to make changes to your treatment to help get you back to the green zone and keep you out of hospital, like changing your medications for a few days. When you're in the red zone, act fast. You need to get help immediately. Call 911 or go to your nearest emergency room. You're in the red zone if any of the following things happen. You're having trouble breathing, you're short of breath, and when you sit still, it doesn't go away. Your heartbeat is fast, and when you rest, it doesn't slow down. You're having chest pain and it doesn't go away with rest or medicine. You're confused or having trouble thinking clearly, or you fainted. When you're traveling, it can be harder to keep heart failure symptoms under control and know where to get help. So it's especially important to continue routines that keep you in the green zone and prepare in advance for what you would do if you get into the yellow or red zone. Talk to your healthcare provider to make sure it's safe for you to travel before making plans. When you leave home, make sure you bring your Heart Failure Zones handout, your sick day plan, which guides you on what to do if you get a cold, flu, or stomach bug. You can ask your healthcare provider for a sick day plan. Enough medications to last your entire trip, and a few extra days in case of delays. A description of your medical history, including a list of all the medications you take and an emergency contact. Your device wallet card, if you have an implanted device like a pacemaker or ICD. Make sure you know if there's anything you need to do about your device at airport security. If you're going to fly, you may want to consider packing these things in your carry-on bag in case your check bag gets lost or delayed. If you're traveling outside of Canada, consider buying cancellation and travel insurance for extra protection. Before you leave, make sure you know where the nearest hospital is in all the areas you'll be going to. Some people pack a scale to make sure they can weigh themselves every day. Planning ahead is key. George, what strategies have you used to monitor your heart failure on a day-to-day basis?
You taught me when I first started coming here, and ones that I picked up when I was in the hospital too, and I think the most important one is weigh yourself every day. That is the only way that you can keep track of any swelling that might be in your legs, particularly your stomach, and make careful records of that. Measuring your blood pressure and heart rate every day. There's been a couple of times where I had to go to the pharmacy to check it, and using an instrument where you can put the cuff on your arm.
What advice do you have for using the heart failure zones?
Probably the most important document you gave me, and the time to go over the warning area, the yellow zone. It's something that really helped me to understand my heart condition, because for my particular type, I didn't know. It was so important that I used to carry this every day, and then made my own little practice, because most of the time it came out during walks and whatnot. And those symptoms, in order to keep track of them, I was fortunate I was able to go and talk to my wife or my children, who helped clarify a lot of the things. And the number you gave me to phone was important too.
How do you keep track of your heart failure symptoms when you're away from home?
Basically following the habits that I've done at home. Each day monitoring yourself, writing notes, keep that habit going, and have your heart failure zone with you. It's important. And I think more important is to plan on if you're taking medicines, to have a sufficient supply to go beyond just your holiday.